All right, welcome to the next part of our topic for today, which is the medication. So I already mentioned a while back regarding side effects. So a lot of people actually ask, I mean, I ask, what do you know about side effects? Is this side effect something that you should know before taking in medicine, or is side effect something that you don't know when you take the medicine?
I think we know already, sir, kasi minsan yung mga doctors or nurse before ka binibigyan ng gamot na yun, sinasabi na yung ganito yung side effect.
Perfect! Pasok ka na sa round 2. So, bilang CNA, guys, once you're giving any medications to your patients, you also have number one, obviously, you have to check whether the patient is the real patient. Mr. Johnson, can you please state your name and your date of birth? I am Melinda. I'll be giving you this medicine. This is for you like that, like this, okay? But please note that this is a side effect. So I want you to eat your food first, whatever. So side effect is something that we know already, okay? If you're purchasing or buying a medicine, it's usually on the box where it says side effects. In other words, again, ang side effect is something that you should be aware of prior to taking the medication. Understand? It is part of your responsibility to give or to inform your patients regarding the side effects. Let's say, for example, NSAIDs, okay? Pagbasa dyan kay NSAIDs, like your ibuprofen. Your ibuprofen, they are very harsh sa stomach natin. That's why it could cause bleeding and ulcer as your side effects. That's why if you take mga ibuprofen or mga pain relievers, you have to make sure that you have full stomach or you have to take it after eating. Okay? So for example, Benadryl or your mga antihistamines na mga gamot, diba? They always say na it will make you drowsy. So that's why number one, first you have to ask whether your patient is going to drive going back home, or are you going to be sundo by your family members, or are you going to take a taxi going home? Because this medicine, if I give it to you right now, it will make you feel drowsy or sleepy. So hindi siya good for people who are driving back home. And normally binibigay siya or it's given to the patients at nighttime or bedtime para they can have better sleep during nighttime. Antibiotics also, it can cause diarrhea. So again, antibiotics are taken PC, which means after meal. All right. Now, adverse reaction, on the other hand, guys, is something that you are not aware of. Kaya sa sinasabing adverse reaction, nag-react yung katawan mo to that medicine. Now, this is not, if I'm the manufacturer of the medicine, if for example, if I'm the company that created the medicine, this medicine is intended for this, the side effect is this, but adverse reaction, which I do not know. Because again, we have our own like way of accepting the medicine into our body. Sometimes it could cause rashes na yung mga manufacturers are not aware of to begin with. So this is your called, what you call the adverse reaction. Okay.
Mahal.
Yes, be.
Sorry, hindi pala ako
Now, the error is what we're trying to
Hingi
avoid.
akong kape.
Oy, sana all may mahal. Error is something that we want to avoid, because error, if you commit a mistake in giving medicine, guys, remember this could cost your license, okay? So that's why number one, it's only be provided by the nurses because it has more responsibility. Kaya hindi siya binibigay na responsibility sa mga CNAs, okay? Error could cause malpractice, can cause your license to be revoked. So you have to be very, 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 very careful when you're giving medicine. Okay. Now, wag na yan, wag na yan. Now, synergism, okay? I'm sure this is the first time that you've heard the word of synergy or synergism. This is when you give a medicine on top of another medicine so that their effect could be doubled or you have better effect, okay? Now, for example, if you have like Sarah is capable of doing something, and then her mahal is also capable of doing something, but Sarah and her mahal, if they are together, they can do more than what they can do individually. That's called synergism. So I want to introduce this word because in a relationship, actually, this is a life a lesson. So you have to find a partner that may synergy kayo na this partner can do on his own and you can do on your own, but when you are together, you can do more. So that's 1 plus 1 is equal to 4, or 1 plus 1 is equal to 5. That's what you call synergism. In a relationship daw ko, no, hindi dapat mag-compromise, because compromise is like a win-lose situation. One wins and the other one loses. But in synergy, you both win. So that's if you want to find a partner in life, you have to have that kind of parang rhythm na you guys complement each other and then you can do more instead of just one is winning and the other one is losing. Okay? Same thing that works with medicine. Anyway, next. Antagonism naman on the otherwise, antagonism in Tagalog is kontrabida or kalaban. So whenever you're taking one medicine, the doctor will tell you not to take the other medicine because it will negate the effect of the other. Parang sayang lang yung iniinom mo kung kunyari, for example, you're taking in a medicine antibiotic, at the same time you're drinking alcohol, they are antagonists of each other. Meaning, wala na. I mean, huwag ka na lang uminom ng gamot if you're drinking alcohol anyway because walang bisa yung gamot na ininom mo. Sayang lang yung pera mo. There. Antagonism ang tawag doon. Okay? Now, let's talk about cough medicine because this is most common for everybody. Okay, on your right side, you have the different types of cough medicine available over the counter or prescription medicine. Antitussive, expectorant, and mucolytic. Okay, which one is bago sa inyong paningin? Which one is new to you?
Antitussive.
Expectorant is something that it will help you like cough out your phlegm. Diba? Expectorant, it will expectorate, help you out na ilabas ang plema. Like ubo ka ng ubo na matigas, you have to take expectorant para it will help you na ilabas ang ano. Especially for old ones or for the babies, guys, since they don't know how to cough properly, so it will be difficult for them to cough out. So the more na magstay ang phlegm or ang bacteria inside your lungs, the more that your situation gets worse. So that's why you have to have expectorant. So yung expectorant is yung alam mo yung ka-text mo siya gabi-gabi and then good night, good morning, kumain ka na ba, how are you? Pero at the end of the day, iniwan ka lang pala si Eric. So that is expectorant. Okay? That is expectorant. Mucolytic on the other hand, it will liquefy your dry cough. So pag dry cough ka lang, so dapat i-help yung mucolytic para mailabas mo ng tama na mas mabilis ang pagaling. Antitussive on the other hand, pero sa English, guys, it's read as antitussive. Okay? Antitussive. So, hi, Mr. Johnson. My name is Joshelle. I'm giving you your antitussive for today. So, antitussive. Okay? Antitussive is to... Antitussive is help you to eliminate yung coughing reflex. If you imagine, like, if you're an elderly person, for example, and you're coughing during nighttime, during bedtime, okay? Are you able to sleep properly? No, right? If you cannot sleep properly, you will not get better faster. So to help them to prevent ng coughing reflex, the doctors are giving antitussive. Makati ang lalamunan, bigyan ng antitussive. Okay? Dry cough, bigyan ng expectorant or mucolytic. So antitussive yung binibigay for you to be able to rest your throat from coughing. Okay? Antitussive. Now, let's talk about medicine. These are the available medicines in the Philippines. Let's talk about yung brand name and generic name. Okay? Between this, nasaan ang brand name? Let's talk about, let's say, Ambroxol at saka Ambrolex. Okay? Which one between the two is brand and which one is generic name?
Ambroxol.
Ambroxol is the brand name. Ambrolex is the generic name.
Very good. That is exactly the opposite. Okay? Wrong. So normally, guys, the scientific name is called the generic name, and the nicer name, which is easy to read, that's called the brand name. Okay, so I will remove this and then I will make it baliktad. Ambroxol is generic, okay? Regardless of who is the manufacturer, they have this parang formula or recipe na sinusunod. It's called Ambroxol or generic name. Now, if I would like to make it more relevant to the market so that the people or the buyers can remember the name of my medicine, I will give a better name, which is called the brand name. Okay, and normally, guys, if you notice, the generic name is put in a square box and it's more difficult to read, while the brand name is more common, easier to read, and it's usually outside the box. Okay, now dextromethorphan HBr, this is the generic. The name in the market is called Strepsils. It's the brand name. Okay, Ascof is the brand name. Vitex, Negundo L, or Lagundilif is your generic name. Now, what is Ambroxol or Ambrolex? What type of cough medicine is this?
Oral drops.
Pectoral.
No. What is this?
Mucolytic.
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 Dry
Strepsils is antitussive. Ito naman is cough remedy lang ang tawag niya. Okay? Now, what is the or who is the manufacturer of Ambrolex?
Dry cough.
Pfizer.
Sino ang company or which company
Pfizer.
manufactured Ambrolex?
Gloxo.
GlaxoSmithKline. Okay,
GSK.
GSK. It's a very
GSK.
famous it's a famous brand. Like Pfizer also is another manufacturer also available in the market. All right, next. So here naman, okay, this Robitussin, diba? Robitussin. Sa Philippines, it's called Robitussin. In America, it's
Robitussin.
called Robitussin.
Robitussin.
Batas.
May coffee na siya.
Or guaifenesin. Okay, ang brand name is Robitussin. Ang
Ang
generic
lamig kasi.
name is guaifenesin. Okay? Now, expectorant, okay? Vicks, ang kanyang generic name is dextromethorphan HBr, like yung kanina. And then the name is Vicks. Okay, did you know that Vicks is the cure for everything according sa nanay ko? Okay? Pag may obo, Vicks. Pag may lanat, Vicks. Pag may sipon, Vicks.
Vicks.
Pag
May
sad,
Pag may sakit sa puso.
Vicks. Okay, Vicks ng lahat.
Vicks
Ang
din.
walang katapat sa hagod ng inay.
Sa maghigot.
Okay, clear. Okay, so understand? Okay, ang brand name is more familiar, easy to understand, to read. Ang generic name is more scientific, it's more difficult to read, and then it's usually inside the box. Okay, now what else? You have your dosage, 15 milligrams for 5 ml syrup, yung mga ganun, and then ito naman is something. It's made by Pfizer. Okay. Now, what is the importance of this? Actually, guys, I'm just telling you this because in the Philippines, there's what we call the generic pharmacy. Okay. Usually, the generic pharmacy is much cheaper compared to the regular pharmacy, like yung mga Mercury drugs, yung Rose Pharmacy, they are more branded name. Sa generica or sa pharmacy generica is just generic brand. So my question is, if you have the same generic brands, generic names, but different brand names, same lang ba ang effect? Is the effect on the body the same? Or
Yes.
yes or not?
No.
No, sir.
Yes.
How is
Depende
it?
to the manufacturer.
Really?
Maybe.
Because of the brand.
So pag branded,
Because
is more
maybe-
effective?
Or the highest.
yes,
Maybe
sir.
because of
Yes,
the
sir.
name of
Sir,
the
it's-
brand.
It's the same.
Because of the formula
It's the same,
series.
sir.
The same.
Okay.
But the thing
Higher
is,
milligram.
the price
Like that.
cheaper. The generic is cheaper and the branded is expensive, but the effect is the same.
Tama si
Because in-
Genevieve. Of whoever
Yes.
agrees to Genevieve, that is correct. Okay. So
Yeah, that's
if
correct.
you have the same generic name, if you have the same recipe, obviously the effect should also be the same. As long as, guys, yung milligrams niya are the same, like 5 mg over 5 ml syrup, that should be the same. But other than that, if there's any difference, pag pareho lang sila ng generic name but different ang kanilang so different din ang effect, obviously. But if you compare an orange to another orange, pero itong orange na to is coming from Switzerland, itong orange na to is coming from Philippines, masarap lang yung Switzerland, pero yung effect, orange pa rin. That's the... So what am I telling you this? So for example, if you have clients who's asking which one is better, there's nothing better than that. But some of the doctors are sponsored by some drug manufacturers or companies. Okay, so
True yan,
this
sir.
specific doctor can only prescribe
Prescribe.
this medicine coming from, let's say, Vicks or from Robitussin lang talaga sila because they have a sponsored or they have a contract with Pfizer. So something like that. And also, as time goes by, the doctors will be able to determine that this medicine is more effective than the other medicine. That's why they will advise that to take this kind of brand instead of the other brand. Siguro it comes with experience. Pero ano lang siya,
Ano na pa ako
pero in to begin with, pareho lang dapat ang effect. They should be the same effect if the same brand, if the same generic name but different brands. Okay, in general lang yan. But obviously, May mga difference ang isa. Okay, next. So which one is faster as far as the effect is concerned? Now, if you notice, guys, if it's through your veins, if it's intravenous, the effect is immediate. That's why when you go to the emergency room, when you say it's an emergency, it's a matter of life and death. So if hindi ka matulungan, mamamatay ka. So obviously, we don't need oral like mga tablets or mga capsule sa emergency room. Lahat doon is through emergency. It has to be injected or it has to be through dextrose. So wag kang magpunta doon sa emergency room assuming na they will not put you a dextrose. Kaya nga sa emergency because it's a matter of life and death. Okay? Now orally, it will take time. Intravenous or dextrose, it only takes 3 to 5 minutes for the drugs to take effect. Clear. Next. Now, so if you have medicine, you have to make sure that these are the essential parts of a drug. Okay, if you are given a prescription, all of this has to be in there. So you order the doctor, the full name of the patients, and of siguro file number, and so on. It's all self-explanatory. Next, so I want you to take a screenshot of this or maybe remember this by heart, because whenever you're ready in the field, you have to always remember the 10 rights of medication administration, which will help you avoid committing a mistake. Okay? Number 1 is right medication. Huwag tayong tatanga-tanga. Okay? So there are times that the medicine are difficult to read or difficult to memorize, but you have to like read it 3 times talaga whenever you give medicine to someone. Okay? Number 2, right dosage. It's self-explanatory. I don't have to elaborate on that. Right timing is also very important. Remember that there's some medicine that has an effect on the body. So sometimes the doctor will tell you to take this after meal, to take this before meal, to take this before going to the bed. It's called the right timing. Aside from that, if sinabi ni doctor 3 times a day or TID, the timing should also be on the right time. Right route. Okay, ang route or route is kung saan mo siya ilalagay or how are you going to administer the medicine. If the doctor will tell you to give it IV or through dextrose and it has to be IV, hindi mo siya pwedeng i-inject. Right patient, how do you know if it's the right patient? Hi, Mr. Johnson, good morning. My name is Lou. Can you please tell me your name? Can I check your ID? And then can you state your date of birth? So 3 times ka nag-check. Tell me your name, tell me your date of birth, and then can I check your ID band? Sharo ma. Mali pa rin. Okay. Right patient education. So again, this is where your education will come in regarding the side effects or yung what is this intended for. Mr. Johnson, I'm giving you a Robitussin. This is for your cough so that you can blah, blah, blah. Have you eaten yet? No. Okay, I want you to eat this one first. Oh, sorry, to eat first and then take this medicine. So this is the right education. Documentation, again, I cannot highlight it
Right documentation.
anymore. Like, right documentation is very, very important. Whenever you give a medicine, you have to make sure that it's documented. Okay? Otherwise, mamaya na lang, hala, namatay si patient. So, paano yun? Busy kasi ako, hindi ko nailista, pero naibigay ko na po talaga. Paano mo yan ipoprove? How can you prove yourself in the court that you've already given the medicine? There was nobody else but you and the patient, but the patient is dead. So, nobody can prove that you are innocent. So, wala, kulong ka. Now, this one is very intriguing. Right to refuse. Does the patient have the right to refuse in the first place?
Yes, sir.
Yes?
Yes.
Now, if
Yes,
the
sir.
patient refuses to take the medicine, I don't want to take this medicine, get the hell out of here. What will you do? Okay, sir, bye. Iniwan yung patient.
You have to explain, sir.
Correct. Explanation is very important.
Educate. Yeah.
Educate is yes, correct. So, Mr. Johnson, please remember, Dr. Perez give you this because it will help you become better. No, I want to die. I don't understand. Blah, 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 blah. Okay, then be creative. How about, Mr. Johnson, if I'm going to give you a spa treatment later, I'm going to give you a hair shampoo. You like that, right? Or maybe I will cook adobo for you. Or I don't know, maybe we can do some TV or whatever. So be creative, but still wala talaga, right? I still don't want to take that medicine. Then that's the only time that you have to report to your nurse or to document that the patient refused after several education, whatever, blah, blah, blah. Okay? right assessment. So if your patient, if the doctor will tell you, give this medicine for pain between 6 and 10. Now you came to the patient, Mr. Johnson, how are you feeling? I'm in pain. Now, between 1 to 10, Mr. Johnson, can you please tell me what is your pain level right now? Maybe 3 or 4. So according to the doctor, dapat between 6 and 10, right? But the patient said that he's feeling the pain level at only number 4. So are you going to give the medicine or not?
No.
You
No,
shouldn't
right?
give it. You should consult them.
You,
Yes.
you will wait.
You will wait
You
until
consult
you
the
become
doctor
7.
and document.
Yes, you're all correct. So for example naman, right assessment, give this medicine if the patient's temperature is more than 38 degrees Celsius, okay? True enough, the patient's temperature is 38.5. Now you gave that medicine. After that, you have to again assess whether the medicine is taking effect or not. So after 30 minutes or 1 hour, the patient still feverish. Then you have to report to the doctor. Doctor, I already given this medicine. The temperature was 38.5. 1 hour later or 2 hours later, the patient still experiencing fever. What will I do? Okay, that's right assessment. And then right evaluations. Again, it's self-explanatory. Okay, next. Now, I've mentioned to you that you have to make sure that you're giving the right medicine. Okay, please lang, wag tayong tatanga-tanga. 3 times for you to be able to check the medicine. Number 1, please take a screenshot of this. Number 1, when you're taking the medicine from the cabinet or from the cupboard or from the machine or whatever, please read the name. Number 2, when you're preparing it, obviously naman, diba, you're preparing the medicine, you're putting it on your tray, you're reading it, read again if it's the right medicine. Patients Ahmed Sama, medicines Robitussin 5 milligrams. Okay, this is Ahmed Sama, Robitussin 5 milligrams. Check 2 times. 3rd time, before going to the patients, before giving it to the patient, Mr. Ahmed, my name is Richard, I'm your caregiver, I'm your CNA. This is Robitussin, this is for your blah, blah, blah. Can you tell me your name? Can you tell me your date of birth? O, diba? 3 times ka nag-check. Imposible, pero mind you guys, there are still nurses that commits this kind of mistake. But you know what, nowadays, the error is going to be lessened na. Number 1, you have this chart. So if you're working from home, you have to also put the chart like this. Make your own chart para hindi ka lang malito. Because honestly speaking, for us people, like for our age right now, we don't really have a lot of medicine we take every day, right? Siguro, we are taking only vitamins every day, right? Or if you guys have maintenance. But imagine if you are a geriatric patient, you're an elderly patient with diabetes, with hypertension, with osteoporosis, or with cancer, for example. Cancer alone, guys, siguro mga minimum 5 medicine that you have to take on a daily basis, right? And then how many patients do you have? Do you think you can remember everything? No, right? So make sure that whenever you give medicine, you have to really document it. Okay, you can do the chart on your own if you don't have. Basic guidelines, again, check for history, for allergies. This is a doctor's responsibility, but your responsibility is just to check on the chart whether the patient is allergic to some drugs or some antibiotics. Obviously, follow the infection control. For example, like hand washing is very important, you know, all the infection controls. Identify your patients with at least 2 identifiers. Can you please state your complete name? Can you tell me your date of birth? And can I please check your ID band? So, ilan na yun? 3 na yun.
3.
Now, in America, guys, this is how their medicine cabinet looks like. Diba? Hindi siya mukhang cabinet, mukha lang siyang photocopier. So, in America, what they have to do, there's a pharmacist that prepares all the medicine for that specific department or for that ward, for example, okay? Now, and then if it's time to give the medicine, you have to put in your number or ID number. Jennifer, ID number is 1, 2, 3, 4, 5. You have to log in with your name. So, dyan pa lang na-filter na kung sino ang nag-dispense ng medicine na yun. And then after that, you have to put the patient's name, the patient's room number. Only that cabinet or that layer will open if you need to give medicine for that person. So that way, na-filter na agad ang error, na-lessen na because there was a pharmacist, you have the ID that collects your information, it only opens to that specific patient. You don't get confused, everything's prepared for you. Okay, so that's how it is nowadays. Again, to avoid malpractice. So the rest of this, I've already sent you that. Again, it's self-explanatory. Ang bottom line nandito is wag tatanga-tanga. Okay? So if you,
Huwag bida-bida.
at wag bida-bida. Ayun lang. Obviously, if you cannot read the medicine, if for example the label is no longer like legible or sorry visible, then please do not give. If it's already expired, do not like our parents in the Philippines always tell us, kaya pa yan, may 1 month pa na grace period. So in America, it doesn't work like that because they have supply, unlimited supply. But in the Philippines, a lot of people are, cannot afford to buy medicine. So they will save the medicine as much as they can. But please do not give expired to your patients. If the color has changed, if the bottle is broken, if the label is no longer legible, so yeah, do not give that one. Okay. Expiration, ano pa ba? Ayun. Okay. Okay, now can you like take a screenshot of this and then during our break try to remember what is the meaning of all these abbreviations. Okay. Next. Sorry, are you taking a picture? Oh, ayan.
Yeah, I was taking.
So ano yung EBID? What is DID, QID, and so on?
DID twice a day.
Yes, twice a day.
Twice a day.
Ano bang ginawa mo?
DID.
Ray, ano bang ginawa mo kahapon? Bakit ka nagkakasakit? Nag-concert ka
TP's
ba?
temperature.
Ray, mag-ano ka, ginger tea ka.
Okay, done. Now, let's talk about prescription. What is prescription in Tagalog?
Reseta.
Okay.
Reseta, sir.
Oo.
Reseta ng doktor.
Oo nga, reseta nga. Hindi siya, kasi some of my students will say resibo. Okay. Prescription is reseta. Ano ang meron sa reseta? Ano makikita mo sa reseta? Jennifer, mabigyan ng isa.
Yung gamot, sir, na dapat
Name of the medicine, Melinda.
Medicine?
No,
Paano
Dana.
Roxol.
Sorry.
Mostly
Knock-knock.
mga reseta is yung
Tanak,
mga
sir.
antibiotics.
No, what can you
Paano?
see? My question is,
Sir.
what can you see in the
Doctor
prescription?
sign.
The sign of the doctor.
Paano iinumin?
If hindi siya sign ng doctor, it's not a legal prescription. How are you going to administer? Is it orally? Is it sublingual? Is it injectables? Okay, what else?
Yung iniinom.
The
Saka
name
yung
of the
Hindi siya
medicine.
sir. Hindi
correct?
siya clear pag binabasa yung ano niya. Yung
The name
writings.
of the patient.
Yes, the name of the patient.
Antibiotic, sir. The medication that needs prescription.
Correct. Ano pa? What
The
else can you
ratio of-
see?
The ratio to intake.
Date.
The
When
date,
the
obviously,
How
because
many
the
times
time.
it will?
Say 3
self-prescription is
times a
only...
day, 4 times a day, once a
Number,
month.
Okay,
number
Once
of
in
days.
Okay.
Physics.
Okay, guys, thank you so
The
much for
ratio of
participation. Some of you, may narinig ako na nag-ask regarding the handwriting. Why do you think doctors have a very bad
Yes, ako
handwriting?
yun sir.
Kasi
Mga
sir,
madali.
sa dami ng mga pasyente, sa kakamadali, sir. That may be.
So
Correct.
because you have a lot of people to attend
I
to,
think,
and
sir,
sometimes
I
they don't
I
want
think sir
the
they write that kind of writing because wala
Purpose
na
to
yata kung ano. There is a purpose on it when you show it to the pharmacy.
Ano yung purpose?
Yung parang yung pharmacist lang yung makakabasa.
Pahirapan nila ang buhay ng pharmacy.
Hindi sir, kasi nababasa ng mga pharmacist yun, which is tayong mga normal na mga kunwari pasyente, hindi natin mabasa. Kaya
Sino to?
parang hindi tayo makabili ng ibang
Si Sarah po.
Jane sir, Sarah.
Sarah Jane. Sarah Jane, yung ganyang pag-iisip, how you understand that is wrong, okay? You know why? Number one,
Okay.
we should not make the life of the pharmacist miserable. Okay. Number two, I would appreciate if the doctor will be able to educate me properly, not only verbally, but also written, right? Para mas magaan ang buhay. You know why their handwriting are very bad? It's because, I don't know sino yung nagsalita kanina. It's because of the
It's
time.
Abdul.
The
Easy.
time
Yeah.
lang ang kalaban nila. Ahmed said that they have a lot of patients to attend to and they don't have the
Yeah,
time
Abdul
to
is
write
correct.
Yes, sir.
legibly. Ayun. Abdul is correct, yes. So, yun lang. You know what? In the pharmacy, that's why they understand that, Sarah, because they have been doing that every single day. So if ever that you are a pharmacist, you will understand that every day you're selling these products, and then even only one letter and the last letter of the handwriting of the doctor, you would already understand that, ay, amoxicillin to, ay, ano to, because you're
Oh.
selling that. And then aside from that, if you're a local pharmacy, you'd know the different doctors in your community, right? Na si Dr. Bonifacio writes like this, Dr. Perez writes like this. If this like only you can only see RI like this, Rubitusin agad yan or something. Okay.
Especially
So,
now,
ayan,
if
sir.
you're going to, ano, sir, if you're going to
Here in UAE,
go
it's,
medical,
different.
they recommend the pharmacy already in the system. So the pharmacy already know.
Pero nowadays, it's no longer a problem because again, it's already computerized. So, correct. So,
Yeah.
yung pharmacy and clinics, they're already together. So, normally they know what to, parang hindi na siya problema nowadays. So, the thinking of that, Sarah, and also the thinking of that the pharmacist, like they have a semester that they study about the handwriting of the doctors, it's not true. Okay, it's not correct. So, alam na yung medicine, prescription, if it's not signed, if it's not readable, you cannot consider that as legal, okay? And it's incomplete, it's not correct. Okay, there. So in America, they always dispense like this. Para siyang may sticker. Like, you know that orange bottle that you see on TV? Na whenever they prescribe something, everything is computerized. May barcode that only for this person you're allowed to give this medicine, blah, 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 and ID and everything stuff. So everything is written there, all that. Here in Dubai, if you notice, it's really different. No, number one, in Dubai, all the pharmacists should wear white coats, right? Para to know that they are professionals. Number two, they already educate us every time that they dispense a medicine. Sir, this is for you. Take this after this, and then they also have to write it on the prescription aside from the prescription that the doctor give us. So I appreciate that, especially in the UAE. And also in America, they are very like that. But in the Philippines, just go, you can buy. The doctor will tell you 14 days antibiotic. 3 days lang muna kasi wala kaming pera. Just give me for
7
3
pieces.
days.
Not follow the.
Yes. Okay. But if here in Dubai, if they told you to give it 1 month, you will give you 1 month worth of medicine. Anyway, so that is prescriptions. Okay. So what will you do if you are unable to read or hear the doctor's order? Ano nga yun? Anong sabi ni Doc? Di ko sure. What will you do? Jennifer.
You can
The-
ask him again.
Are you sure you want to ask the doctor? Hey doc, ano nga ulit yung sinabi mo? Is that correct?
Yes.
Wait lang. Ah.
Kanina pa tong buhay na to.
Okay, so yes, kung sino man yung sumagot kanina, you are right. Please do not hesitate or do not be ashamed to ask your doctor again. I'm sorry, doctor, but I did not hear what you say or I cannot read what you have written. Can you please tell me again what is this? Para sa akin, no, for me, I'd rather ask the doctor rather than give the wrong medication because of my assumption. So wag tayong asumera. So whoever answered that, you're right. Okay. Now next. If the name of the medicine you cannot read, you cannot hear properly, ask the doctor. Okay, so yun. Okay. I think that's about it. Any questions? The rest kay ano na siya, self-explanatory. Okay, any questions regarding medicine, administration of medicine? I think I'm done. Please take time to read all of this. I've elaborated this in a very easy manner, so you can just check it online. I mean, yeah. Anong oras na?
1:26 po.
We are up to 2 o'clock, right?
Yes.
Okay.
Yes,
So-
almost.
One more round. So I already have less than 1 minute. If you have questions, you can put it on WhatsApp or, and then we will meet again after 10 minutes. Okay?
Okay, sir.
All right. Bye.
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 Yeah.